Hi, I'm Bobbi-Jo. It's great to meet you with you today, and I'm really grateful you're going to share some information with us. Can you just start off by sharing your name, pronouns, and just whatever kind of basic information about yourself that you want to share?
Sure. I'm Terry. Also nice to meet you. I'm actually like glad to be doing this. I think it's super interesting. She, her. I feel like you probably get the slap with the basic information as like my Achilles heel because it's, like the meme. Like, do you want my favorite color or my trauma?
Yeah, right, exactly.
But so I live on the East Coast, so I'm talking to you from New Jersey. I'm married. I have a 9-year-old son who is also an ADHDer, so we have lots of fun in our house. My
Mhm.
poor husband is not that we know of. Um, Dog and a cat, and I feel like I have the trifecta going. It's like I have, I'm an ADHDer, my son's an ADHDer, and I am a therapist who specializes also in ADHD. So I kind of have it's all around me all the time.
Yeah, I definitely relate to that. That's what I tell people is like I pretty much just live and breathe ADHD all day, um,
Yes.
in all the roles, all the
Yes.
facets of my life.
Yes. Sometimes I have to remind myself that like, oh wait, this isn't actually everyone, right? Like my sample is skewed.
Exactly. Yes, absolutely. Tell me a little bit just about your own kind of process of how you came to learn that you have ADHD.
Yeah. Um, so I actually was only diagnosed a couple of years ago. Um, it's one of those that I think like we're learning so much now is actually not an unusual story, but seemed like one even just a couple of years ago when it was happening. So my son, um, is like who the criteria was written for.
Mhm.
Like his picture could be in the DSM. So when he was in kindergarten, we started kind of going through the process with his school. And it was to the point, like by the time we even really were pursuing formal assessment, it was like we kind of just needed someone with the right credentials to be able to put it on paper. We kind of
Mhm.
there was no question what was going on.
Yep.
Um, and then of course from there, like as a mom and knowing the language, it's like the deep dive started and
Mhm.
continued. And, a year or so later, it was like as I was combing through some more articles and research, I started seeing, some adult ADHD things. And then I started reading some women in ADHD things. And I can't remember exactly how, but I read this one article and it was kind of like I got punched in the gut a little bit. And I had this very like dissociative, like, stop gaslighting yourself. This is not, stop being so dramatic. Like this cannot be. Um, Lo and behold. I thought about it for a little bit, sent it to a therapist friend of mine who knows me very well, and she responded like in all caps, like, holy bleep, this is you. Um, so I started doing some more research for myself,
Mhm.
and eventually, I'm the type of person who's like, I started Googling like free assessments. So I got the ASRS and started doing that and like all these other things. And then I finally made an appointment with a psychiatrist. Um, I kind of went into it just like, all right, I need to know if I'm making this up or not. Like, is this
Mhm.
possible or no?
Yeah.
Yeah. And by the end of the session, she was kind of, the typical like, listen, there's no brain scan, but you're checking the boxes. So
Mhm.
yeah, so since then it was like, then you do that whole looking back and it's like,
Yes.
this makes so much sense.
Yes. That next process of recontextualizing your entire life experience
Oh
through a new
yeah.
lens. Yep.
Yep.
Yeah.
Yeah.
Very, very typical kind of process that happens then.
Yep. Yep. Got through school, straight A's, all of that. I never made problems. I was nice, nice and smart and all of that. And it was probably not until like my son was born that it's like that's when things really started to
Mhm.
unravel.
Yeah.
Yeah. So it was definitely an
Can you
interesting.
share a little bit more about what you noticed that was different? Because I think that's always a really important point around that connection. What did you notice that was different when your son was born, or how did you see a shift happen there?
Um, so I think like the big things, like looking back, and I feel like it's so hard because it's like what I noticed in the moment and now looking back how I can see it, right? Like it's like with the
Hmm.
information I have in the moment, it was this sense of like the wheels just came off. You know what I
Hmm.
mean? Like the things that I'd always just felt like, is this really this hard for everyone? Like, but I'm kind of like holding it together, at least externally. Like, I feel like those things were like no longer possible, like
Hmm.
where it would feel like it would bring me to tears by the end of the day just to be able to do like day-to-day things.
Yep.
Um, like keeping up with, like there's so, his stuff, my stuff, the house stuff, the cleaning, the dishes, the cooking, all of those like day-to-day things where it's like you hear but you're so smart. How come this
Hmm.
is so hard? Like those things
Exactly.
just unraveled.
Yeah. Yeah, and I think it's also so hard when you're a new parent, if you're unidentified, like you really don't, because you don't have that context of ADHD on the radar often, you just think like, is this how everybody feels after having a baby?
Mhm.
Or you assign meaning to yourself as a parent and how you might be doing. And so I think
Yep.
that just makes it even more complicated, right, in that identification process of just assuming either like, oh wow, life with a child must be awful or I must be really bad at it.
Yeah.
And it is hard, I think, even for providers to pull that apart because of course it's normal for lots of people to struggle, ADHD or not,
Right.
adjusting to having
Absolutely.
a child, right? And
Yes.
so yeah, there's a lot kind of wrapped up in that, but
So many threads.
it's a common experience, right, for folks to maybe it sounds like you were one of those people who had that capacity to kind of maintain up until a point, but then something in your life shifted, and then
Yep.
whatever coping strategies you were maybe unconsciously using, you had reached that capacity level.
Absolutely. And looking back, it was like even I got through school on, all-nighters, cramming, last minute, I can write a
Hmm.
10-page paper overnight if I really have to. And because I was, smart enough, it was
Hmm.
like I'd still do fine, you
Hmm.
know. And then yeah, looking back, it's like working. I was talking to my husband about this the other day. Like every professional job I've ever had, and I've been in the field since undergrad. So I've been in the field like almost 20 years. Um, every job I've ever had, like documentation has always been my weak point, like from
Hmm.
day one. And I think it was like because I was like likable and because I was like good at the clinical piece, it's
Yep.
like, while the
People gave you a
documentation,
little bit more room than maybe
yep,
they
it
would
gave
have
me a
others.
buffer. It
Hmm.
gave me a buffer where it's like I didn't ever get fired. However, like it was like, come on, dude,
You got
like,
talked to a lot, yes.
yep. Yeah,
Hmm.
so it's like piecing that all together was really interesting, where it's like then there just
Yeah.
came a point where it's like, okay, the wheels are now like completely fallen off.
Hmm.
Yep.
Yeah, um it makes me wonder a lot. I'm not working in a larger agency, but how much supervisors, those that are supervising therapists, have that on their radar, right? Like many people do struggle with paperwork once again,
Sure.
but is that a chronic thing? And does it feel like, do they seem like they're completely overwhelmed by it constantly? And
Yeah.
so I think that's another good thing for folks that are working in supervision kind of capacities to just be
Yeah.
aware of or paying attention to that could be a sign, and then could
Absolutely.
could really help some of their
Yeah.
uh
I remember
goals.
a former supervisor when I was in I'm in group practice now. So it's like, but when I was in a big agency, my supervisor at the time, like, and we've maintained a friendship and a professional relationship. So it was like a really positive relationship. And I was talking to her one day and it was like from a genuine place of concern of like, help me with like, what is the barrier? Right. Cause it was one of those like genuine confusion of like, you are
Mhm,
so good at X, Y, and Z. And I'm not like, it's not making sense to me why this is such a struggle.
mhm.
Like, what do you need help with so I can help you? Like, it was a genuine, like, she wasn't
Yeah.
trying to be a jerk. And I literally, because I didn't know, I didn't know. And I literally sat there and was like, it was so hard because I was just sitting there like, I don't know. Like, I don't know what to tell you. I don't know why I can't do this.
Hmm.
Like, it was such a frustrating for both of us,
Yeah. Yeah, I think a big piece that people don't know or don't pick up on is just that there's an expectation to do the note immediately after. And working with lots of therapists, it's task switching, right? Like it is a different task to do therapy than to document. And
Yep.
when I do a group support program for therapists with ADHD,
Yep.
and like we spend a bunch of time talking about like even just the documentation, there's like a whole bunch of mental processes that are often
Ugh,
happening, but we are not just simply documenting this is what happened,
right.
right?
Yeah.
And so when you take all that into context, it makes sense. And so a lot of times it's also about structures and like, agencies expect that you're going to do your note immediately after, but that's just not enough time for ADHD brains to task switch and complete it
Yep.
before their next appointment. And so, we just need to do things in a different kind of way. And then often people find lots of ways to manage it, and it is not
Yeah.
nearly the struggle that
Yep.
it is otherwise. But yeah,
Right.
which I think
Yep.
is another piece too, is right. Obviously, certain settings are going to have expectations that, to be honest, are not good
Yeah.
for any person, ADHD or not.
Yep.
Um, but also for those who are neurodivergent, then those expectations can just be like disabling,
Right. It's
where
an
others
extra
might be able
layer.
to manage the stress and all of that. And so that's where
Absolutely.
some of that separation starts to show up too. How has that now kind of identifying the ADHD impacted your life, or how have things changed for you since then?
Um, I think the biggest thing is the shame, right? Because I think that is like looking back, it's like, oh, like a lot of people use anxiety to manage it without knowing. And I think that's like one typical like presentation in women. And mine was like anxiety, yes, but also shame. It was like,
Mhm,
maybe I can just like beat myself into submission here to like make myself get it done.
mhm,
So I think like being able to go back and almost like reformulate all those memories. I'm like, oh, I'm not just, that book, like I'm not just like lazy and stupid or whatever.
mhm.
Um, so I think that's been the biggest thing is like it's really helped me to understand myself better and to see like, oh, okay, it actually makes sense that like the hard things are easy and the easy things are hard. And that makes sense given just like
Yeah.
how I now understand my brain works.
Yep. Yeah. And
It's
once
been
you have
huge.
that acceptance, then you can also move towards strategies and all of the rest of the things.
Exactly. Where it's like, okay, now I actually have the freedom, right? Like that it doesn't feel like, well, I shouldn't need this,
Hmm.
like it, whether I should or
Yeah.
shouldn't, like, no, I do.
Yeah. This is hard for me. And so I need to figure out a way to manage it.
Correct.
um,
Yeah.
and not having to go through all of that mental turmoil process before
Gymnastics.
you can get there is a lot more helpful, right?
Yep.
For sure. Um, Switching a little bit into just talking about your experience being in therapy, how many mental health therapists have you worked with over your lifetime that you can
Tried to
recall?
count. I think
I know a
it
lot of these questions to ask ADHDers to come up with data
I
is
know.
pretty contradictory,
That's
but
okay. It's either four, I think it was five, I think five individual and two couples.
Okay. Yeah, and to what extent were your ADHD traits a reason for ever pursuing therapy? I know it's been semi-recent for you.
Yeah. So I guess like the actual like what I was going and saying was the problem. ADHD was actually never like why I went.
Hmm.
Looking back, like my first time in therapy, I was in middle school.
Hmm.
Like for myself. Like I went to therapy like family stuff earlier, but for myself I was in middle school and like looking back like that was really more for like depression. Um
Hmm.
and again looking back I was like, like I wonder how much of that was related.
Yeah, to
So
shame
I don't know.
or
Yeah.
how you were feeling about yourself for things that you were struggling with. Yeah.
Yeah.
Yeah, for sure. In your experiences with therapy, have you had any things that have occurred that were really unhelpful or unaffirming that stick out?
Yeah, so I haven't had any therapist do anything like blatantly unaffirming.
Okay.
And which is great. And I think a lot
Hmm.
of times, like probably because I really, again, wasn't necessarily there to deal with ADHD specifically.
Hmm.
I think what has happened that I can't even blame the therapist for, because right, like the majority of mental health therapists are not trained
Yep.
in this stuff, is that without knowing, right, like you don't have the ADHD context, like some things that therapists would say to me that were meant to be validating. um, I would then shame myself for. So like I was thinking about a therapist I had in grad school. So I was working full time during the day and going to grad school at night. And I was just, there's relationship stuff and I was struggling, lots of
Hmm.
anxiety happening. And in like, probably good attempts to validate that experience, she would kind of say or kind of try to help me with like, you're really being hard on yourself here. Um, and while yes, I was, I think there's also a part that I would then take that and inside there'd be this little voice, but like, but you don't understand like this, like I couldn't put into words or I couldn't say that like, this isn't just happening because I'm so busy, right?
Hmm.
Like I could have all the time in the world and I still won't get it done,
Yep.
you know? So I think the validation of like, like, look at what you're doing. Of course you're not going to get everything done.
Hmm.
And then internally there'd be this little voice of like, oh God, like if she knew that like I wouldn't get it done anyway, like God, she would think
Hmm.
so differently of me,
Yeah.
So
I
that
also I
hard.
also just found myself thinking about, which just feels like an important point to make, that kind
Mhm.
of aside from there, that, often people will assume then you are just too busy and you need to slow down, which sometimes is often true for ADHDers.
Sure.
And there's also this like perfect balance that if we are understimulated and don't have enough, then we also cannot, you know,
Mhm.
perform, if you will, things
Yep.
well. And so
Yep.
sometimes that unintentionally, what seems like, oh, you have a lot and you're not managing, the assumption is
Mhm.
reduce and it will get better. That's not, if there's executive functioning skills that are struggling, it doesn't matter how busy.
Yep.
I mean, it does matter how busy, but like,
Of course, but
simply just reducing it alone isn't
right.
going to necessarily fix,
Right.
executive
Right.
functioning.
Right. And while it was at the time, I was like, yes, I know I'm hard on myself. This is not news, right? I know I tend to be perfectionistic. This is not news, right? Like I know I am a busy person. This is not news, right? And so right, it's like, okay, I get it. And there was definitely this sense of like, and I'm also somehow pulling this off, but I'm really just lazy. You know what I mean? Because like I could have 3 hours to sit in front of the computer screen and I'm still not going to get it done. And it's like, I
Mhm.
can't tell you that because there's so much shame, you
Yep.
know?
Yeah,
So,
and sometimes things are getting done, which makes it even more complicated too, but, like, it doesn't feel satisfying. It like,
right.
people aren't, and often people are then praising the things that are getting done, but they're not seeing what's happening internally in order for you to get that thing done,
Yep.
which adds a whole 'nother layer of complication often.
Absolutely. Yeah. I think about that a lot, the difference between like the functional impairment as opposed to just like the internal distress, right? And like
Yep.
that was so real for so long.
Yeah. Um, Anything else, I guess, that comes up for you as far as just those kinda unhelpful or unaffirming, I guess, nobody noticed in the many years as well.
Right. Well, that's the other interesting thing that I think back to that same therapist. And at the end of our treatment, she did say something along the lines of like, because I went because I was having a lot of anxiety. And she said something to me later on in our treatment. And she was like, you're not actually an anxious person. And I was like, right? Like, so it was kind of like I think back to that no, I don't think she caught the ADHD, but it's like there was still something that was sticking out as like, this
Not
isn't
hitting a
just like
typical.
typical
Yeah.
anxiety, right? Like there's something else happening here.
Yep.
Um,
Yeah, which I
yeah,
think is really hard for therapists to pull apart, right?
oh, yeah.
Because on the surface, it looks very similar, right? Of like,
Mhm.
just like, oh, I'm always worried. Just to add that tidbit, the piece that I often, when working with therapists, is to really ask questions about the nature of those anxious thoughts and like if all of them can be related back to executive functioning or other ADHD traits, and the person's not also, now some people certainly very clearly have both, like generalized
Absolutely.
anxiety disorder and ADHD, but
100%.
I often find a lot of folks that I work with, when you start getting really curious about what kinds of thoughts are we talking about here, it's things like, what if I forget to do this? And what if I can't get this done? And what if this
Mhm.
person thinks that I overshared? And if that's really the only kinds of anxious thoughts that they're having, but not like, what if it snows too much today and blah, blah, blah,
Yeah. Yep.
and more generalized, uh,
Yes.
then I like to perceive that often as like the ADHD being primary, whether they meet criteria for an anxiety disorder or not
Right.
is debatable, but often I find when that is the presentation, that when the ADHD is better managed and like understood and strategies are there, that anxiety just goes
Yep.
away without intentionally even working on it, right?
Yep.
And so
Absolutely.
I think that's always just an important tidbit there too for a therapist to be aware of, but it is hard
Yes.
to really pull those apart,
It's
and
so hard to
many
tease
do
apart.
have both, right?
Yeah. Oh, yeah. And going back, right? Like looking at it, a lot of the things that were creating the anxiety was the running lists in my head and the
Mhm.
I'm going to forget and I'm going to, oh my God, I have so much to do. And it was all executive functioning and relationship. But I think that was a totally separate thing. You know what I
Yep.
mean? Like, but also the emotional
Yeah.
intensity did not help. Right. Like,
Yeah.
so
Yeah,
yeah,
and I think that's the other piece, is that just racing thoughts when somebody shares, "I'm having racing thoughts," we tend to, as therapists, move to
anxiety.
anxiety when, again, what's that question about the content of those racing thoughts? I will often say too, like, a lot of just ADHD racing thoughts are literally just free association, word salad kinds of things that,
Yep.
like, they aren't actually worrying about there's no worry in it. Sometimes it's just,
It's
what would
just
happen if
jumping.
it's just, yeah, what would happen if this thing happened and then this and then
Yep.
this, and oh, I wonder about this. It's not distressing.
It's
Uh,
right. But
it
it
becomes
looks like
distressing when it
anxiety.
impact like you can't sleep or it impacts
Right.
things, but it's not there isn't a sense of fear that's necessarily underlying it, which is
Yeah.
that difference. And so
Yep. I
it's
said to
another.
my husband the other day, I'm like, all right, you think in like A to B. I think in like those really complicated connect the dots. Like, and it
Mhm.
goes all in like a second,
Yep.
like that's just how it is,
Yep.
not just how my brain works.
Yeah. Do you feel like you have been able to feel 100% yourself and just like unmasked when you're working with therapists, or do you feel like you've needed to mask in some way?
I think so my current therapist, I think is probably I don't ask at all. And to be fair, I wonder how much of that is like it's the first time I've been in therapy since knowing that
Yeah.
so I was kind of bent on like, nope, this is it. This is how it is. Like,
Hmm.
and I think knowing that has been super helpful because while he's not a specialist in ADHD, that's not like why I'm going, but it has been very helpful even to have like there have been times where he's like, well, that's just how your brain works, like it's not an excuse for like bad behavior, you know what I mean? But like it's just how your brain works. So like this is who you are, and then this is what we need to work on.
Hmm.
So I think to have that understanding even has been super helpful as opposed to genuinely just not knowing and assuming that it is right, like that it's
Yep.
connected to something else, where I think there's
Yeah.
been asking in terms of like what I was saying before, the feeling of shame of
Hmm.
like, I'm not like someone's trying to be validating and saying like you're too hard on yourself. And inside I'm thinking, yeah, but if only you knew how hard it really was, or if only you knew that like, but I wouldn't be able to get this done even if I had all the time in the world. Like you're giving me too much credit.
Yeah.
Um, so I think there's been some masking in that regard that felt like I'm not being 100% honest. And I think there was a lot of shame behind that. So I think
Hmm.
that like masking in that regard for
Yeah.
sure.
Yeah, and for some people, it's also just like feeling like they have not necessarily for the therapist. Well, I guess for the therapist somewhat, but like feeling like they have to mask simply because our thoughts can be so rapid and so disconnected. And so even just some people will do that work of like really holding back their natural thought processes just so
Yeah.
that their therapist can more easily follow. Um, but that also is a lot of mental work, right? Just to simply participate in therapy.
Yep.
Um, and another way that that often can show up for some people, if and there's a lot of things then that therapists can do to encourage that not to happen, but there's also a lot of things that they might subtly do that makes that end up happening, right?
Right. Right. Even without knowing, right? Like, and I say all the time, it's like therapy's not, it's like going to a doctor. Like, not all doctors do everything and not all therapists do everything. And it's like
Mhm.
from the best of intentions, but
Yep. Yep.
Yeah.
Yeah, and I also think that's another good point that I'm thinking of connected with that right now is just also for therapists to know, like, I am unmasked with my therapist because I'm taught like I feel like if I can't do that, then I'm not gonna
This is
get the
not helpful. Yeah.
I need one space for an hour
Yeah.
every so often that I don't have to
Yep.
compose everything perfectly, right? And
Yes.
so, and so it's also important, I think, to not make assumptions for therapists about what their client is like as they navigate the world. Because if my therapist made assumptions about how I present,
Yeah.
they would probably like wonder how anybody can communicate with me. But like I am very different because I'm unmasked with them, which is actually a positive thing. That means
Right.
there's safety and trust.
Yes.
Than how I am with clients or others or things like that.
Absolutely.
And so
Yep.
I think that's another downfall that I see is sometimes therapists will be like, I don't know how they're managing. Just because they're like this with you, they might be unmasked and you get to see the real them, but
Yeah.
nobody else might be
Right.
seeing that, right?
Yep.
Um, and so any specific things that therapists that you've worked with have done that was really helpful for you, related to ADHD traits or pieces around
Yeah.
that?
I think the biggest is like simply that acknowledgement of something that maybe like I have assumed has been like a character flaw my whole life, right? Like I think
Mhm,
just the acknowledgement now, like, because again, like it's not, I've never been in therapy specifically for like ADHD related reasons, but I think even just the ability to like parse out and acknowledge that, okay, the idea that you are impulsive or interrupt, or the idea like that's not because you're a narcissist, it's because you're impulsive, right? Like this is how your brain works,
mhm.
right? So I think the ability to like just parse out like these things are not character flaws. These are part of, right? Like just how
How
your
your
brain
brain.
functions.
Mhm,
I think that has been super helpful. And to be able to separate that out and like, well, here are the things you do need to work on, given this is how your brain works, right? Like rather than, well, this is a flaw, let's change it. Because
mhm.
that's not going to work.
Yeah, absolutely. Um, if there were any accommodations kind of just related and think broadly related to your
Mhm.
ADHD that you would want from a therapist, and this can be realistic or it could be like a dream world,
Pipe
of
dream.
like
Yeah.
like if I could design this perfect setup, this is how
Yeah.
it would be.
So I'm thinking of it like for me, I'm thinking of it from both directions right now. And I feel like, all right, pipe dream. Um, Having therapy spaces that were conducive to movement, like being able to like walk and talk therapy kind of thing.
Mhm,
Um, I love that idea. Being
mhm,
able to like, throw things around, like throw a ball back and forth while you're doing therapy, like those things would be super cool. Um, Even just like being able to stand up and walk. Like
yeah,
I think that's a huge one.
yeah. Walk and
Otherwise,
talk therapy does exist. Some people are
yeah.
out there doing it. It's a tricky one with
Sticky ones
confidentiality though, but
navigate with license it. Yeah,
yep.
yes. But yes, I know it does exist.
Yep. I think it depends a lot on what kind of models you're using, right? Like traditional kind of talk therapy does well, but if you're doing some kind of deeper work intervention, sometimes it's not the
Right.
best for that. But
Yeah.
yeah, just
Yep.
incorporating movement more for sure.
Yep. Feel like for me this is gonna sound like so obvious, but like text reminders for
Yep.
appointments. I mean, that's a big one. Like it's on
And
my calendar.
it's not standard for all practices,
It's
so
not.
it's
It's
important to make
not.
sure.
And it's also like it's the text reminder and also it is set up so that it is on my calendar. So I get my own, you know what I mean? It just the link is right there. I don't have to find it every week.
Yep.
Like if you're doing virtual therapy, like those types of things are super helpful. Otherwise, I'm gonna consistently be like 2 to 3 minutes late because I'm searching for the link.
Mhm.
You know? Um, which sounds silly, but I feel like those are like the basic like
Yeah.
accommodations that I think for me would be
Yeah.
helpful.
Yeah. Um, is there any kind of message that you would like to share with therapists about how to best support someone with ADHD?
Um, I think one, like understanding enough to, again, like be able to delineate like what is something that needs treatment and what is part of a person's nature,
Mhm.
right? Like, and that is going to be different with people who are neurodivergent. So I
Mhm.
think that's huge to understand. And along with that, like also just, I think the big thing for me, even more so than the messages, is like know when you're outside of your scope.
Yeah.
Because, right, like I think that's the biggest one is like there is no shame in referring, right? Like if what you
Mhm.
know is the DSM, like just know that that is not enough when it comes to like women, older like teens, adults, anyone who doesn't fit like, the stereotypical hyper 7-year-old.
Mhm.
Um, and that if that's not something that you're well versed in, then like there's no shame in finding someone who is and, you know,
Mhm.
passing it off. I think that's a big one because like not everyone can do everything. So I think there's harm in
Yep.
pretending you can.
Yeah, but I think at the very least, at least having enough information for that, like, recognition piece, because the other piece is you are, you know, eh, statistics are about 5-ish%, but that's we have to also
Pretty
assume that
high.
we also have to assume that that's lower, and I always like to point out if you have certain other specialties, that percentage is much higher. So if you specialize in working with LGBTQ folks, it's going to be much higher. If you
There is a need to be,
um,
yeah, there's a need.
and or other specific niches, which ADHD is correlated with many things, but
Mhm. Sure.
yeah. So there's a lot of different things too that can increase those chances of just how many folks might be on your caseload that you don't even know.
Yep.
Um,
Yeah, I
and
think
so
that's, and you know what, now that you're talking about this is another, just thought of another one, so I'm sorry.
no, go ahead.
Um, I have even heard recently of people being told that they can't have ADHD as an adult because they did well in school.
Hmm.
And that's one of those that I feel like again, when like my little bubble, right? Where I'm like, oh God, people still say that and believe it. And these are people
Regularly,
who are
yes.
right. And these are people who are advertising themselves as like adult ADHD specialists,
Hmm.
right? Who are then telling people like, oh, well, you never failed a class or you were on honor roll
Hmm.
or whatever. Like there's no way.
The key that I like to bring up for those folks who might have that is that if we really want to stick with DSM with all its flaws for a second, though, is that technically even within the DSM, you just have to have two areas of life that it's impacted. It does not say it has to be school or work. And
Correct.
so I think that's an important distinction that even for those folks who like really are following closely the DSM,
Yep.
um,
Yep.
there is, if you read it closely, it does not say it must be those two areas. And
No.
so,
It's function, and I think a big differentiation is like the functionally versus distress, right? Like
mhm,
it doesn't have to mean you failed, right?
correct.
But were you having to like work a lot harder than everyone else, or right, like was it
And
sometimes like
understanding
you
how intelligence can, I mean, the bigger piece too is understanding how
intelligent,
intelligence can
yeah,
mask for that too, because that's
yeah,
often, I don't think we have any great
too
research on this because giftedness becomes it's a whole convoluted conversation too, right? But like
correct.
my experience is many times the folks that I'm working with who are getting diagnosed as adults often are gifted in some way. And so it's often because they, had that giftedness, it compensated for their struggles, or they were able to get by enough
Mm-hmm.
because of that, again, until typically they reach that
Something,
capacity
right?
line, something, whether it's for many
Yep,
women, it's childbirth, for others, it's major life change or a big change in structure. I used to work
yeah.
at a college. That's
Oh
often,
yeah,
that's a
that's a
big
big
one
one.
that we see is that, in high school, you get there's so much built for structure for you, but in college, you are now 100% responsible for structuring yourself. And actually those gifted kids sometimes do worse, to be honest, than those
Yep.
kids who were that had ADHD only and were
Yeah.
identified younger
Earlier.
because
Yep.
they had to learn skills to manage, whereas those kids who didn't struggle don't even have a frame of reference of how to study or how to structure their time because it just worked for them before.
Yep.
And
Yep.
so yeah, so it's interesting all those different changes, but yeah, that's a huge, myth that absolutely, I mean, I have clients who have recently had assessments by professionals that quite literally it says in there like because of their IQ testing results they cannot have ADHD, and then it's usually like even though they have this and this sometimes even, and I was like,
Like,
how do you make that choice? But
right. Like, I don't think that's what it means. Yeah, no, I get
yeah,
it. I get it.
because often like when you read the assessment results it's like to me it's screaming ADHD because I know what to see and look for, but
Yeah.
yet
Yep.
like just dismisses based on one thing.
Yep. Yeah. And I think, I mean, and it doesn't, that's the other thing that the diagnoses, like the assessments don't account for, like,
Compensation stuff.
have you, like, what systems have you developed over time that have gotten you
Yes.
by? You know
Yeah.
what I
Yeah.
mean? Like, I recently was talking with someone who was like, okay, now that I know this, I'm really interested to like figure out more about like what I've been doing to like keep myself
Mhm.
afloat. Cause like it's one of those, once you know, you start to
Yes.
piece it all together. So it's like,
Yeah. Yeah, I use a lot of those tests ask about like, do you frequently lose your keys? And I always use that as a perfect example because if you stop there, my answer would be no. But the reason I don't lose my keys is because every purse I have has a key pocket that is designated. And before I get out of my vehicle, I check that I have put the key into the key pocket. And then that purse goes in a very specific spot in my house. Were I to not follow any step in that process, then yes, my keys are lost.
correct.
However, I have trained myself because of enough times of losing my keys
Yep.
that that process is necessary. So
That's
on
right.
the
Like if you don't ask that, like, or have you developed very specific systems and structures that prevent you from, right? Like
right,
then
yeah,
you're gonna get like no,
yeah.
or
So
like
my
maybe
suggestion is
sometimes, but
my
yeah.
suggestion is to often if you're using tools that don't have that to sometimes add that caveat to just say
Yep.
without substantial effort to
Yep.
the end of the question is a good way
Yep.
to at least start a conversation about
Right.
things a little bit more.
Yep. For sure.
Because again, those who don't struggle with it don't have to put substantial effort into not losing their keys or
Correct.
whatever.
Right.
Yeah, and yes, everybody does lose their keys on occasion,
Right.
but
Yes.
not everybody is spending 15 minutes most days of the week searching for them.
Yep. Exactly.
Uh,
Yes.
And so kind of the last question I have is just more general for anybody, who might be watching that has ADHD or
Mhm.
anybody, for therapists to hear also that they can maybe share, what's one ADHD management strategy that you've picked up in your life that's been like a game changer for you? What's your favorite system?
My favorite system. Ooh, there's so many. I want to say the biggest like overarching one, like, because I'm thinking about the things that really are like my personal Achilles heels. Like, I think the biggest one for me is body doubling. Um,
Mhm.
because and scheduled body doubling.
Yep.
Like that, right? Like making like having an actual date and time,
Yep.
because things like body doubling to get my notes done, or my husband and I now have a system where it's like, all right, we sit down and go through the mail together at these times.
Yep.
And that's the only way the mail pile will get gone through.
Yep.
Right? Like, so things like that where it's like you don't even realize you're doing it, but
And
having
sometimes the other person can simply just be like in the space with you and not
present, just be
actively
there.
doing anything, but like saying, I am going through the mail now.
My son and I body double. Like he has to do reading every night and he'll now come to me and be like, Mom, do you want to sit and read with me? So like I'll read my book while he's reading his, like, so it's like, okay. Or I'll even notice he's doing his homework and I'll be like, dude, I'm going to set up and do a couple notes while you're doing your homework, because
Mhm.
just he's 9, right? But like having him physically there
Yeah.
is keeping me on task. Like
Yep.
it, it works.
Yep.
So finding ways to like do that, even when it's like when you first hear about body doubling, it sounds very like now I have to be here and but it's just sometimes having another person physically present,
Yep.
can help it
Or
get done.
virtually. I always like to add that caveat because not
Yes.
everybody has that. And I think that's a good thing to know is that there are those options. There's several websites that
Yep.
offer it virtually, whether free or paid. And
Yep.
some people feel more comfortable doing it with a complete stranger, if
Mhm.
especially if they're like dealing with some shame. And,
Oh yeah.
sometimes people are like, I don't want to have to ask somebody to sit with me while I do my dishes. then
fine.
that's actually where virtual stuff can be better. Like you
Well,
have no
yep.
connection to this person. They're also choosing to
Yep.
have you help with something because they struggle too. And so,
Yep.
um,
I have a
so
friend who every now and then we're both therapists and we will be like, all right, let's like let's Zoom or FaceTime or whatever, get some notes, like bang some notes out and I'll like set my little timer and be like, all right, 30 minutes go. And then we'll kind of like check in and
check
chat
in.
for a minute. It's
Hmm.
like, you want to do another 30? And
Yep.
so yeah, it's like an
Yeah.
easy,
Yeah.
but yes, not knowing, it seems like what the heck, like, but yeah, it's a huge one.
Yeah, that is one that is really helpful. And it's also interesting for a lot of people how much, and again, I think there's many non ADHD people that also find that helpful too, right?
Of course.
Like,
Yeah.
um, if you think for a lot of people that have been to college, thinking about college experiences, people do that a ton
Oh
often
yeah.
in college, or like they choose to go to the library because even if it's like distant, just knowing somebody else is
There's
also
other
working,
people.
or
Yeah.
roommates working on their own things. And so,
Yep.
yeah, there's a lot of ways that we informally already do it and just don't think about that's what we're doing.
Yep.
But yeah, I think that is a really great one. Anything else that you want to share that, feels really important that I didn't ask or we didn't touch on?
Gosh. Feel like this is where I get into my own trap where it's like either I'm
I
gonna
know that
say
was way
little
too
or too
open ended.
much,
I
right?
know that
Like,
was way too open ended of a question, but I always
no,
like to
I get
offer
it.
it in case like you were like, this is a point that feels important and I didn't ask quite the right question for you
No,
to
that's
bring it
okay.
in.
I can't think of anything in particular. This is one of those things, like, I feel like you, I could probably talk all day about it, but
Yep.
yeah, in terms of like, here's a specific little tidbit, I don't
Yep.
know that there's anything coming to mind right now.
Okay. Well, I very much appreciate your time and
Uh,
sharing your experiences with us. And yeah, thanks again.
yeah, thanks for doing this. I'm like really curious to see where it goes and what you end up doing with it.
Yeah.